of work now, in
Well,
addition to the
May Trauma Awareness Month. Here to talk to us today, Dr. Thomas Clancy, Director of Trauma Services with New Hanover Regional Medical Center. Trauma is costing the U.S. more than $585 billion a year. We were just kind of talking in the break there. I was asking the doctor just roughly what his day is like from start to finish. I appreciate the time. Thank you for coming in this morning.
Thank you very much for the invitation.
That is a hefty price tag. When it breaks down locally, as far as New Hanover County and New Hanover Regional Medical Center, how much of an effect is trauma at that hospital?
We're going to see upwards of 1,800 trauma patients to be admitted to the hospital this year, and several thousand patients a year arrive with injuries nationwide. This is on the order of 41 million emergency department visits and 2.3 million hospital admissions. So it's a very widespread problem. Everyone's familiar with it. It's on the news every night. And we have a trauma center here that serves as a regional resource for taking care of all of the injured patients in Southeast North Carolina.
And because of the vastness of the area, as far as you said 1,800 a year, was it 1,800, 18,000?
1,800.
1,800. Where does that rank you statewide?
Statewide, I would say we're probably in the top 5 of trauma centers in terms of volume. And it's a patient population that is primarily a younger population. Trauma is the #1 killer of people less than 50 years old. And as a result of that, for all of the mortality associated with it, which is upwards of 200,000 patients a year in the United States, it serves as a problem that also brings the elderly in with falls, and it's the #1 reason for why people over 65 are admitted to trauma centers as well.
As the calendar gets ready to turn and we head towards the summer months, do you see an uptick in events as the summer
Every
falls
summer.
here?
Every summer, our population down here doubles, minimally. It doubles to triples, and as a consequence, when there's more people, there's more trauma. Car wrecks, falls, various kinds of summer-related accidents that can occur. So yes, the numbers go up substantially in the summer.
I have to tell you, I don't have a lot of time for an answer on this, but I just am curious, with the number of events that you see and as taxing it is on the hospital, what can people do to limit this?
Well, the nice thing about much of the trauma that we see is that it is preventable. So we have numerous safety initiatives that are going on all the time. Clearly, all of the things involved with driving, motor vehicle crashes and falls are up there. Unfortunately, the violence-related issues are a little more problematic, but I think that people being careful, what the kids learn in school about distracted driving and texting and drinking and all these things, which do account for a substantial number, obviously can be addressed.
All right, Doctor, again, I appreciate the time this morning.
Thank you, Bob.
Dr. Clancy with us here again from the Hanover Regional Medical Center. We're back with more after this.